Hello there, I'm going to be doing a presentation on Alzheimer's. My name is Taylor Foster. Feel free to pause to read the slides and look at the pictures. So Alzheimer's is the most common type of dementia, and Dr. Alois Alzheimer found it. That's why it's named after him. So the symptoms of Alzheimer's is memory loss, can't carry on a conversation or respond to the environment. So Dr. Alzheimer, he noticed that the brain tissue of a woman was changed, and she had symptoms of memory loss, language problems, and unpredictable behavior. So as a scientist, when she died, he examined her brain and found abnormal clumps called amyloid plaques, which we'll be talking about later. So here is a demographic of comparing African Americans and Latino Americans with their health issues. And as you can see, with the higher percent of diseases that they have, the more likely they're going to have Alzheimer's. And there's a reason for this, which we'll talk about later, and it has to do with genes and how genes affect, if you have a certain gene, how it can cause these diseases. So age is the best known risk factor for Alzheimer's. The older you get, the more likely you're gonna see it show up in your brain if you're gonna have it, if you do have it. So it's not really sure what causes it yet. Family history may be a factor, but not always. So, and usually Alzheimer's starts to show up ages 65 and up, and the more that you get older, the more that you're gonna have Alzheimer's, and it will get worse. So here now we're gonna go over the causes of Alzheimer's. So basically, a quick summary. Just a quick takeaway is Alzheimer's disease is caused by the abnormal buildup of proteins in and around brain cells, and the structure of the protein molecule changes to cause the chain reaction that leads to the death of neurons in the brain. So neurodegenerative process is the protein molecule cells will become corrupted. And so the proteins will misfold around surrounding normal proteins, and then they stick together in the clumps, and then they become into unwidely protein tendrils. So now the proteins that are causing this is the first one's called amyloid, and these are deposits which form in plaques around the brain cells. And the other protein that causes this is called tau, which deposits in the form of tangles within the brain cells. And here's a picture of the amyloid plaques and the tau tangles. So here's more information about the cause. So the protein fragment beta amyloid is mainly what's indicated in the Alzheimer's disease. So it destroys the synapses before it clumps into plaques that lead to the nerve cell death. And then the synapses are the connections between nerve cells, which are essential for storing memories, processing thoughts and emotions, and moving around your body. So when the synapses are destroyed by the protein, then also your memory and such is destroyed. Here's a picture of a healthy brain and an Alzheimer's brain. Here's the neurons I was talking about, and as you can see on the right, the amyloid plaques are surrounding the neuron in the Alzheimer's disease brain, and then the healthy brain is a normal neuron with no plaques around them. So the protein forms around the neurons, as I was saying earlier in the previous slide. And the beta amyloids, they start as a solitary molecule, but then they tend to bunch up to small clusters which can still travel around the brain, and then plaques, which are the cause of Alzheimer's. And then when these protein clumps form, a chain reaction is triggered that multiplies these protein composites, which I was saying earlier, but this is more of like a simplified, easier way to understand it. So, and then they activate new focal points, and then this damages, obviously, the protein tendrils. And then here's a picture of a part of the neuron called the microtubule. So the Alzheimer's one is obviously destroyed because of the tau protein, and the healthy one is normal and not falling apart. So the ventricles are, they protect and maintain the nervous system, the central nervous system, and that controls like awareness, movement, sensations, thoughts, and speech, memory. But when these ventricles are enlarged, the surrounding brain tissue dies. So yeah, you can like see, MRIs can see the progression of the ventral expansion. So Alzheimer's, it does damage to the temporal lobe of the brain, and then when it gets worse, it moves on to other parts of the lobes and also does damage there. So the brain ventricles are essential for maintaining the central nervous system. And as you can see here, the ventricles in the Alzheimer brain is a lot bigger versus the normal brain. They're a lot smaller. It's the blue part right here. So yeah, it's destroying the brain matter in the Alzheimer's brain. So now we're going to talk about pattern of inheritance. The dominant pattern is one copy of an altered gene in each cell is enough to cause the disorder. And as I was talking about in the first picture about genes being related to diseases, so the APOE4 gene is the first gene identified and the strongest impact with Alzheimer's. An estimate of 40 to 65% of people have this gene that have Alzheimer's. So, and then there's also two other types of the gene in the APOE gene, which is E2 and E3. So here's a picture of the APOE gene, and then here's all the parts and diseases that can be caused by it, such as heart attack, stroke, diabetes, Alzheimer's, obviously, because that's what we're talking about. So yeah, the more that you have this gene, the more likely you're going to have these problems. So there's no current cure for Alzheimer's, unfortunately, but there's two ways to help prevent it. Is recruiting the immune system, which removes the plaques that have formed, and then by like stimulating the immune system, because the plaques are foreign invaders, and then preventing destruction is the drug turns off the protein that I was talking about that allows the synapses to start working again. And so they did this with mice, and there was actually a reversal of some memory loss. So they're still testing that out in Alzheimer's patients. So good luck to them. So here's a little bit about grief. Like knowing someone that has Alzheimer's can be hard because eventually they will probably forget you. And they will remember their name or your name, even if you're their husband or child. So it can be really hard. Some prevention is, there's no way to prevent Alzheimer's, as I was saying. There's no like 100% way to stop it or anything like that, or know if you're gonna have it later in life. But having a healthy lifestyle can help reduce the chances or improve it. Scientists are still doing research on that, but it's always good to live a healthy lifestyle anyways to prevent other diseases as well. So here's a little recap of the slideshow. So if you just want a basic summary, you can read this, and then here is some more symptoms of Alzheimer's that they will have in these pictures, and read them. And then the last slide I have for you guys is my references and sources. Feel free to read these and check out more information. Thank you. Bye.